So let's pull up her. I'm gonna look at this view first, then I want to have her stand up and we'll look at kind of her profile.
Okay, great.
All right, so we've had electrical problems and it may not be working this room yet. So you'll have to look at it at the small screen.
That's okay. That's okay.
So just look straight ahead.
Okay.
And then smile real big and bite your teeth together. Open. Now close. Can you close on your back teeth? All right, smile.
If I can just smile regular stuff.
Yep. Open. Open real wide. Open up for me. Yep. And slowly close. Yeah, she's posturing forward, which is fine, as long as she's wearing that mouthpiece. So, let me see her. Do you have her guide?
Yep.
Yep. So, that tells me that's where her jaw wants to be. Her lower
Okay.
jaw.
Okay.
And when the teeth are in the way, she can only put her jaw where the teeth will dictate. But because she's going through a transition right now, she probably doesn't have a true place where teeth touch well.
Okay.
Try that in. I'm gonna make sure you can put it in the right way, okay? Do you know how to put it in the right way? That's a trick that another kid taught me.
Yeah.
Smile. All right, look up a little bit. All right, so show me how you squeeze when you're doing exercise. Squeeze. Just hold it tight for a little bit.
Remind us about the exercise,
Yes.
guys.
All right.
Okay.
So with the exercise, I want them, anytime they have that guide in their mouth, the teeth need to be in the slots, the top
Okay.
and the bottom.
Okay.
So really the best thing to do is have them keep their lips together.
Yeah,
And
which I
that'll-
have
that'll-
been saying.
that'll
Okay.
keep, really, in order to keep their lips together, their jaws are going to be closer.
Okay.
So I want them wearing the guide for, let's say, like an hour part of the day, another hour another part of the day.
Yep. Okay.
And I want them squeezing for, let's say, 30 seconds. And
Okay.
then relaxing for 15 seconds.
Oh, okay,
Or
okay.
any combination of like half and half. Like,
Okay.
so it could be 10 seconds, 5 seconds. But
Okay.
I want them squeezing more than they're relaxing.
Okay.
And
Okay.
so that's exercising. So what happens is they squeeze, the little slots inside the guide are pushing on the teeth to push them where we want them to go. And as they relax, it's getting blood flow back to the teeth. So it's intermittent
Oh,
as
okay.
opposed
Okay.
to pressure all the time with braces.
Right, right,
And they're controlling how hard they squeeze.
right. Not the
so
awful
the body-
soreness of.
The body won't really let you do something that's gonna, like, if you squeeze something too hard, it's gonna hurt.
Right.
And so they get to control the movement. And
Okay.
so as their teeth start to erupt more,
Okay.
they'll basically guide into those slots.
It seems like the one tooth.
You can take that out now.
Yeah. Or is it his? I forget. They're both losing some teeth. Seem to be coming in straighter.
Yeah. So come over here. It's actually, as teeth are coming in,
Yeah.
like if you were to wiggle that tooth right there,
Okay.
you'd actually see that it has a good bit of movement in it.
Oh, okay,
It
okay.
has to be essentially fully erupted before the ligament will basically solidify.
Okay.
And so as they're coming in, we can guide them anywhere we want.
That's great.
Stand
Okay.
up for me. I want to have you stand up, and then I want you to look at that screen and see if you can make that face. Can you? Yep. So yeah, very little. I mean, look how deep the bite was before.
Wow. Compared.
Yep. So ideally, we want like just a little bit of overlap and overjet.
Okay.
And her midlines are already good, and so a lot of symmetry.
Seems
and-
like her jaw's grown, like her face
So
and smile. Yeah.
We want this to expand some.
Okay.
It's not going to be quick.
Okay.
And even forward some.
Okay.
But as her jaw expands the top, it allows the lower jaw to move forward.
Okay.
So the lower jaw hasn't necessarily grown more, but now it has room to go forward.
Okay.
What do you think? Is it pretty easy for you? All right, so now I want you to stand next to the wall right here for me. And then look down the hall. Let's face that way too. Yep. I'm gonna move your hair out of the way.
Sorry.
It's kind of hard to tell. Stand with both feet on the ground and move away from the wall. I don't want you holding the wall up there.
Yep.
And can you hold your hair like that, woman?
Sissy, can you hold your hair on one side?
Yeah, let's just get it over your ear.
Yeah, we're looking at your posture.
Yeah.
Thank you.
Looks about the same right now, but
Probably mom could do a little bit better at chiropractic care too.
but here's if her airway is narrowed, she's got to have she's opening it up some.
Oh, okay.
And so now that we're working on her airway, you know, she's learned this posture.
Yeah.
You can work on
The other.
getting it more ideal.
You know, because there's some days too we don't have this sleepy eyes,
Yeah.
you know, but he's has it much worse.
Yeah. And
Yeah.
it definitely can be from sleep issues. It can also be from allergy issues. It
Yeah.
can be a combination of both.
Well, not wearing his teeth
Yes.
trainer all night too would be the other thing. Good job, Sarah. Good job. I don't know, you asked the doc.
What'd you ask?
What do I do?
You can trade seats with your brother.
All right, Joshy, your turn.
You want to put that back in her case?
Yeah, thank you. Oops, I got it.
Right here's her leg.
Okay. And his.
I'm gonna look at your picture back here first, okay? So what I look at here is how much of the bottom teeth can we see,
Okay.
and if his overjet and overlap are being corrected, then you'll start to see more of these bottom teeth.
Oh, okay, okay.
And eventually we want this to get a little wider as well.
Okay.
And it looks like but if you look how his arch looks more squared, it's like
yeah.
zoom, zoom.
Yeah.
We really want it just kind of
Out.
a big U.
Okay.
And so this is in a good position, but this posterior section on both sides needs to kind of come out some.
Okay.
And you can see the same on the bottom where it's kind of squared.
Surprisingly, though, I think I'm seeing changes with him too.
So
He's
the-
good at day wearing. We're still just not getting the full night.
So with day wearing, when you're awake, you swallow twice as much as when you're asleep.
Okay.
So
Okay.
each time he's swallowing, 4 hours of day wear is the same as 8 hours of night wear.
So maybe even getting him to wear the TT1
Yep.
during the day.
Yep.
Okay.
So either one of those is doing something,
Okay.
and it could just be keeping his lips together.
Mm-hmm.
And eventually we want to have enough room. So right now he doesn't have enough room on the roof of his mouth for his tongue.
Okay.
Your tongues are not squared.
Right. Right.
And you may see somebody that has like a pointed tongue, and that's because their arches are too narrow, and it's just learned how to fit in that spot. But you want it to look like a big frog almost.
I wonder if our speech will improve too.
Your tongue should rest on the roof of your mouth, So that's where a lot of words like they call it the N spot, like you say nana. That's where your tongue should rest.
Okay.
Most people have a low tongue posture that rests kind of around the plane of the teeth, not on the roof of the mouth.
Okay.
And so they have to actually get their tongue back to say certain things. So it's more work.
Makes sense.
All right, so let's go back to this picture right here. So I want you to bite like that so I can see how your face looks like that. So turn towards me.
For the doc.
Look straight at me. Look up a little bit.
Now bite like that again.
Yep.
Yeah.
That's good.
Good job, Josh.
Good. Give me 5. I say that I can see maybe a little bit more on this side right now than I could.
Okay.
And I don't see a big change, but I see a change.
Okay.
So
Yay!
show me. I want to see you where.
Gotta put your thing in.
Put that one in for me. All right. So yeah, squeeze. Squeeze and keep your lips apart so your mom can see. And smile real big. If you see like where it's blanching, squeeze again. That means it's putting pressure on those teeth.
Okay.
So that's another way to see if when they're exercising, if it's effective.
Okay.
Like every now and then just kind of like have them squeeze. And if you see a little blanching, then it's putting pressure on those teeth.
Okay.
And they're going to want to either enjoy that pressure or move.
Okay.
So,
okay.
You know, most of the time they're going to want to move.
Okay.
All right, let me see. You can put this back in here. I want to see how you do with the other one. Which one is your favorite?
Let's see.
Yep. This one or the other one?
I don't have a
Okay.
favorite.
You like them? You like both of them the same?
I
Okay.
still say yes because they both look the
They
same.
Good.
Look.
Try that one in. Now this one has more ability to expand the arches. There's those little wings on the side, and so as he swallows, if his tongue is behind his teeth. All right, keep your teeth together and squeeze. So this is how you can check to see if he's swallowing better.
Okay.
When you swallow with this, you almost have to squeeze real hard, and you shouldn't see his tongue go forward.
Oh, okay.
Yep. All right, so look at me, smile real big, and then try to swallow. All right, so you didn't see his tongue come forward.
No.
Yeah. All right, now take that out. So his tongue
Put it away, good.
should
Oh, wait.
basically be above those two little dots.
Dots. Okay.
And as he swallows, his tongue will push those little fins to help
Out.
expand his arch.
Okay.
So it's giving this, it's kind of guiding his tongue where to go, and then the extra thickness is just giving like a little bit more pressure than the tongue can give by itself.
Okay.
So
So we
it's
should
not
be
rapid, how
we should be squeezing with the habit trainer
Well,
too.
when you swallow, in
have
order
to.
do it, you almost have to squeeze properly.
Okay. You know,
So
I
it's
sleep
not necessarily exercising.
I sleep at night with my watch, and you can see how much you're awake. And I'm like, I think I'm snoring. I'm like trying to keep my mouth shut at night now. I'm
So
like,
there are 2 good books that I've finished since your last one.
Okay.
Was Breath,
oh, okay,
and James Nestor, I think,
Okay.
author of that one. And the other one is Why Do We Sleep, and it's the science behind it.
oh,
And that
okay,
one is, both of them are fascinating, but breathe or breath has to do more with your airways in general,
okay,
but the other one has to do with just the importance of sleep and the different stages, and if something's not right, what
Yeah.
can happen with your sleep, and
yeah,
it's fascinating.
yeah. That's very, very cool. So I can't wait till the doc is ready to take adults too,
Well,
right?
We're just about there.
Okay.
And we're crossing T's and dotting I's.
Good, very good. Awesome.
Well, I'm pleased with everything. So it's everybody progresses at different stages. As long as I'm seeing progression, then that's
good.
Yep.
So stick with the, kind of morning, afternoon, or twice a day with the Oculus. And then the habit trainer still keep that at night, and then for him sometime during the day as well. Okay. And
And anytime you notice lips apart,
okay.
just put your lips together.
Okay. Yeah.
And as he gets more room, as his arch expands, he'll have more room for his tongue. So it's
Okay.
kind of easier to keep the lips together at that point.
Okay. We got to come up with some different contests too.
Yep.
Yeah. Okay. That'll be good. That'll be good.
Any questions?
I don't think so. Do you guys have any questions?
Yeah.
We have to do this.
That's a great question. So you won't have to do it every night forever. Okay?
Okay.
So then there'll be a point where when you've lost enough teeth, we'll just have you kind of wear it maybe a few times a week.
Oh, I have one.
Mhm.
Are you gonna switch things up? Like this is for day and the other one's for night.
I may. Yep, I may.
Okay.
But
Very-
with him, if his adenoids are a little bit enlarged,
Yeah.
then he's going to have more trouble breathing through his nose. And so as we good.
Good.
So he's still going to be in a transition where the more arch expansion we can get, that'll actually widen his nose.
Yeah.
in his
And the
airway.
better. Yeah. I'm sad because one of my neighbors, they want to take their son's teeth out and he's so little. And I'm like, just wait, just try this, just
We
try
will.
this.
We have, I guarantee you that 80% of the parents that come in say the same thing about somebody like a neighbor or a cousin.
Yeah,
Like,
yeah.
They just feel bad, and it's like, I feel bad too.
Yeah, I know. Plus you're only one. I'm going to